Deep vein thrombosis, or DVT, is a serious medical condition that occurs when a blood clot forms in one or more of the deep veins in your body. While it most commonly affects the large veins in the leg, these clots can also develop in other areas, such as the calf, thigh, pelvis, and even the arms. In rarer cases, they can form in the veins of the brain, intestines, liver, or kidneys. Understanding this condition is the first step toward prevention and effective management. Recognizing the signs of DVT is crucial, though not everyone with the condition will experience them. Common symptoms include pain in the affected leg, which might feel like a cramp or soreness, noticeable swelling, and changes to the skin. The skin over the affected area may appear reddish or discolored and feel warm to the touch. In some instances, skin sores or ulcers may also develop. Because symptoms can be subtle or absent altogether, it's important to be aware of the underlying risk factors. Several factors can contribute to the development of DVT, generally related to anything that prevents your blood from circulating or clotting properly. Damage to a vein, whether from surgery, a significant injury, inflammation, or an infection, can increase your risk. Age is also a factor, with the likelihood of DVT increasing after 40. A sedentary lifestyle is a major contributor. Long periods of inactivity, such as during long-haul flights, extended car rides, or prolonged bed rest after an illness, can slow blood flow and lead to clot formation. Other risk factors include certain cancer treatments, heart failure, and underlying genetic predispositions that affect blood clotting. One of the most dangerous complications of DVT is a pulmonary embolism, or PE. This happens when a piece of the blood clot breaks free from the vein, travels through the bloodstream, and becomes lodged in an artery in the lungs, blocking blood flow. Symptoms of a PE are sudden and severe, including sharp chest pain, shortness of breath, a persistent cough that may produce blood, and feelings of lightheadedness or fainting. A pulmonary embolism is a life-threatening emergency that requires immediate medical attention. To diagnose DVT, a doctor will typically start with a physical exam and review your medical history. They may then order specialized vascular testing, such as an ultrasound, to visualize the blood flow in your veins and identify any clots. Blood tests are also essential, measuring levels of substances like antithrombin 3 and proteins C and S to check for clotting abnormalities. In some cases, genetic testing may be recommended to identify inherited mutations that increase your risk of forming clots. Treatment for DVT focuses on preventing the existing clot from growing larger and stopping new clots from forming. The most common treatment involves anticoagulant medications, often called blood thinners. For more severe cases, a doctor might use thrombolytic therapy, which involves powerful drugs that can dissolve clots quickly. Other interventions include placing a stent to keep a vein open, or inserting a vena cava filter into the body's largest vein to catch blood clots before they can travel to the lungs. Fortunately, there are several steps you can take to prevent DVT. Regular movement is key, especially during long periods of sitting. On a flight, try to walk around every half hour, and on long car rides, take a break to stretch every hour. Flexing your calf muscles regularly also helps promote circulation. If you've been sick or have had surgery, moving around as soon as your doctor says it's safe is important. Wearing compression stockings can also improve blood flow in the legs. Making broader lifestyle changes, such as maintaining a healthy weight and staying active, can significantly lower your risk. Ultimately, a quick and accurate diagnosis of deep vein thrombosis is vital to prevent life-threatening complications like a pulmonary embolism. Managing this condition effectively often requires a collaborative effort from an interprofessional healthcare team, ensuring you receive comprehensive care tailored to your specific needs. By understanding the risks and taking proactive steps, you can protect your health and well-being.